A very good evening to you, our dear viewers, and welcome to your health show here on TV1 every Monday to Friday. With me, your host, Kaitesi Elizabeth. So thank you for joining us today on this Friday, June 19th, as the world commemorates World Sickle Cell Day, a day dedicated to raising awareness about sickle cell diseases and promoting early screening plus supporting those living with the condition. So today we bring you the stories that matter to your health and your well-being. In our top story, we have health experts highlighting how body alignment and spinal decompression therapies are helping patients overcome the chronic back pain. And in more, Tororo General Hospital moves closer to improving emergency health care with the completion of a new staff housing complex. Plus, government raising concern as sickle cell diseases continues to contribute to under 5 deaths in Uganda. And health workers in Chontela are intensifying efforts to address vaccine resistance plus World Health Organization issues. Updated global guidelines are attempted and aimed at improving access to safe drinking water. So those stories and much more are coming up. Stay tuned and let's go straight into our top story for today. Now, health experts are encouraging people suffering from persistent back pain and neck pain to seek professional medical care early, as modern non-surgical therapies continue to provide effective relief for spinal conditions caused by poor posture, sedentary lifestyle, and also physically demanding work. So medical experts say that cases of back pain, neck strain, and posture-related disorders are on a rise as more people spend long hours sitting at desks and are using electronic devices or performing repetitive physical tasks that place excessive stress on the spine. Now, health professionals claim and explain that one of the most effective approaches to managing these conditions is body alignment therapy, which focuses on correcting posture and also restoring the body's natural muscle-skeleton balance. Now, according to physiotherapists and spinal care specialists, body alignments places unnecessary strain on muscles, joints, and the spine, leading to chronic pain and reduced mobility and poor physiological function. So correcting posture helps reduce pressure on the body and improves movement and lowers the risk of recurring pain. And experts say that many patients who seek treatment for the ongoing back and neck pain are found to have posture and body mechanics problems that can be corrected through guided therapy and rehabilitation. So another treatment today is gaining popularity, and this is lumbar traction, a non-invasive procedure that gently stretches the lower spine of the body to relieve pressure on the spinal discs and also the nerves. So the therapy is commonly recommended for people living with herniated discs and also chronic lower back pain. And during the procedure, specialized equipment applies controlled pulling forces to the lower back, creating space between the vertebrae and also reducing compression that often causes pain and numbness plus restricted movement. Closely related is spinal decompression therapy, an advanced treatment that uses computerized traction technology to target specific sections of the spine. And the therapy helps relieve pressure on the compressed discs and nerves while encouraging the movement of oxygen, water, and essential nutrients to the damaged spinal tissues, promoting healing and recovery for the patients. Health practitioners say that spinal decompression has shown encouraging results in the treatment of chronic back pain and also the bulging discs and also degenerative disc disease and other nerve-related spinal conditions. And patients who have undergone these therapies often report significant reductions in the pain and also improved flexibility, plus better posture and an overall improvement in their quality of life. However, However, specialists caution that these treatment outcomes vary depending on the severity of the condition, plus the patient's general health and their commitment to following the medical advice and the rehabilitation programs. Doctors emphasize that these therapies should not be viewed as a stand-alone solutions, but also should be combined with regular exercise and proper posture and healthy weight management plus professional medical assessment to achieve lasting results. Healthcare providers are also urging the members of the public not to ignore the persistent back pain or rely solely on the painkillers, warning that untreated spinal conditions can gradually worsen and eventually lead to long-term disability and also reduced mobility. So they said that early diagnosis plus timely intervention remain the most effective ways of preventing minor spinal problems from developing into chronic and life-limiting conditions. So as awareness of spinal health continues to grow, experts believe that licensed access to non-surgical treatment options such as body alignment, lumbar traction, and spinal decompression will help many people regain mobility, reduce back pain, and enjoy healthier and more active lives. So health professionals continue to encourage the public at large to prioritize their spinal health by maintaining good sitting postures and staying physically active and seeking medical care early, because early attention leads to better life. So whenever persistent back or neck pain develops, we should follow the guidelines given to us by the health professionals. Now, from that story, moving on to our next story for today. Now, emergency healthcare services at Tororo General Hospital are expected to improve significantly following the near completion of a Shillings 2 billion staff housing project that will enable critical health workers to live within the hospital premises and respond more quickly to emergencies. Now, the construction of the multi-story staff housing complex at Tororo General Hospital is now approximately 90% complete and is expected to be officially commissioned by the end of this June. So the housing units are being constructed by the UPDF Engineering Brigade at the cost of more than 2 billion Uganda shillings. Now, this project is funded through compensation from the standard gauge railway project after the hospital's former staff quarters were demolished to pave the way for the railway construction. Now, district leaders said that the absence of on-site accommodation has negatively affected healthcare delivery over the past few years, and particularly during nighttime emergencies when medical personnel have or had to travel from outside the hospital to attend to critically ill patients. Now, Tororo District Chairperson John Okea says that the demolition of the previous staff quarters left the hospital without residential accommodation for its health workers, making it difficult to guarantee immediate medical response during the emergencies. So once completed, the new housing facility will accommodate at least 16 essential health workers, and including the frontline medical personnel whose presence within the hospitals is highly considered critical for the provision of the round-the-clock healthcare services. Now, the Tororo District Health Officer, Dr. Onyango Gajira, says that hospitals operate 24/7 a day and requires medical staff to remain within the easy reach to ensure that patients receive timely treatment. And whenever these emergencies arise, he adds that the hospital health workers within the hospital compound will improve response times and strengthen service delivery, plus enhancing the overall quality of the patient care. So although Tororo General Hospital employs more than 100 staff members, only a limited number will benefit from the first phase of the housing project. Now, this has prompted district leaders to call for a transparent allocation process that prioritizes frontline healthcare workers where services are essential to medical care and hospital operations. Now, the resident district commissioner Albert Amula has urged the hospital management to ensure that the available houses are allocated fairly, with the priority given to critical staff who provide essential medicine services. And leaders have also called for improved professionalism and accountability, emphasizing that better staff welfare should translate into better patient care and improve the public confidence in the hospital. So the chairperson of the hospital management board, Jackson Oboth, says that measures are already being strengthened to improve the accountability and also discipline among health workers. He also noted that the communication channels have been opened to enable members of the public to report these cases of negligence or mistreatment of the patients. So authorities believe that the completion of this housing project will not only improve the welfare of the health workers but also strengthen the emergency medical response and reduces delays in the patient care, plus contributing to the improved healthcare service delivery across the rural district. So, hospital officials said that once commissioned, the new staff housing complex will play a key role in improving emergency response, enhancing staff welfare, and also supporting the delivery of quality healthcare services at Tororo General Hospital. Now, moving on into our story today. So as the world marks the World Sickle Cell Day, the government has raised concern over the growing burden of sickle cell disease, revealing that this condition contributes to approximately 16% of the deaths among children under the age of 5 in Uganda. And also officials are now calling for increased screening, early diagnosis, plus public health awareness to save more lives. Now, the Ministry of Health says that sickle cell disease remains one of the most Uganda's leading inherited blood disorders and continues to claim the lives of thousands of children every year. And according to the government statistics, nearly 20,000 babies are born with sickle cell disease annually, with many failing to reach their 50th birthday due to the preventable complications and delayed diagnosis. So the disease now accounts for an estimated 16% of all deaths among children under 5, making it a major public health concern. Now, health experts said that sickle cell disease is a genetic condition inherited when both parents carry the sickle cell disease trait, and the disease causes red blood cells to become abnormally shaped, restricting the blood flow and leading to severe pain, plus anemia, infections, stroke, and damage to the vital organs. So as Uganda joins the rest of the world in commemorating the World Sickle Cell Day, health authorities are urging couples to know that their sickle cell status before marriage and encouraging expectant mothers to ensure newborns are screened immediately after birth. Now, the Ministry of Health says that early diagnosis remains the most effective way to reduce child deaths, and as children identified at birth can be enrolled into specialized care programs, receive routine treatment, and be monitored to prevent life-threatening complications, government has already rolled out a nationwide newborn screening program aimed at detecting the sickle cell disease early and linking affected children to treatment. Now, officials said that this initiative will improve survival rates and reduce the burden on families and healthcare systems. Now, medical professionals are also emphasized that the importance of public awareness, noting that many Ugandans unknowingly carry the sickle cell trait because they have no symptoms. They say that voluntarily testing before marriage and planning and family planning decisions can help reduce the number of children born with this disease. While there is currently no universal cure for sickle cell disease, doctors say that early diagnosis and regular medical care, plus vaccination and proper nutrition, and also infection prevention and timely treatment, have enabled many people living with this condition to lead healthier and productive lives. So as the country together commemorates the World Sickle Cell Day, health officials are calling on communities to fight the stigma and support those living with the disease, and also embrace regular screening as a critical step towards protecting future generations. So this year's World Sickle Cell Day serves as a reminder that awareness and also early screening and timely treatment remains Uganda's strongest tools in reducing preventable child deaths and improving the lives of people living with the sickle cell disease. Now, from our story about sickle cells, moving on into our next story for today. Now, health workers in Chotela district are now facing a growing challenge in improving childhood immunization coverage as the resistance from members of the religious sect continues to undermine the vaccination efforts, raising concerns over the risks of the preventable death outbreaks. Now, health officials said that some members of Serulanda Spiritual Foundation in Kabila sub-county continue to reject the routine childhood immunization, citing religious beliefs, faith and healing, plus mistrust of the modern medicine. Now, this resistance has become one of the biggest obstacles in achieving the district's vaccination targets. And according to the Chotela District Health Officer, Dr. Edward Mwanga, the refusal of some families in this area to vaccinate their children has made it difficult for health teams to protect communities against the preventable diseases. He says that immunization teams often encounter families who deliberately avoid vaccination exercises by remaining indoors or temporarily leaving their homes whenever outreach teams arrive. And in some cases, health workers have also experienced the hostility while attempting to engage members of the community. So Uganda's routine immunization program protects children against the several life-threatening diseases including polio, measles, tuberculosis, hepatitis B, diphtheria, pertussis, tetanus, and rotavirus. And medical experts warn that children who miss these vaccines remain highly vulnerable to the infections that can result into the severe illnesses and the permanent disability or even death. So they caution that declining immunization coverage increases the risk of diseases previously brought under control and re-emerging within these communities. Health officials attribute much of the vaccine's resistance to misinformation and also the misconceptions surrounding immunization, with some members of the religious group believing that prayer and fasting plus traditional herbal remedies offer a sufficient protection against the disease. However, healthcare providers insisted that the vaccines remain one of the safest way and the most effective public health interventions, preventing millions of deaths worldwide every year. So officials said that they have intensified community sensitization campaigns by working with the local leaders, religious leaders, and health educators to build trust and dispel the myths and also encourage parents to immunize their children. So meanwhile, some members of Serulanda Spiritual Foundation have rejected the claims that the entire religious community opposes vaccination. They urge that many followers fully participate in the government health programs and regularly take their children for immunization, adding that a few individuals should be used to represent the entire faith. Like a few individuals of this community, Serulanda Spiritual Foundation, should not be used against them to represent the entire faith, with some going for vaccination and some not. So district health authorities said that the dialogue and also community engagement and also the health education remain critical in addressing the vaccine hesitancy and ensuring every child receives the life-saving immunization services. So health experts continue to remind parents that routine immunization is one of the most effective ways of protecting children against the preventable diseases, and urging communities to work with the health officers to ensure that no child is left behind. Now, moving on to our final story for today. Now, the World Health Organization has released updated global guidelines on drinking water quality and urging the governments to strengthen water safety systems to protect communities from the waterborne diseases and ensure access to safe drinking water. Now, the new guideline provides countries with updated recommendations on how to improve the quality and also the safety of drinking water through stronger regulations and better monitoring, plus improved management of the water sources. Now, according to the World Health Organization, safe drinking water remains one of the most important requirements for protecting public health. And however, more than 2 billion people around the world still do not have access to the safely managed drinking water, with millions continuing to rely on rivers, lakes, and other untreated water sources for their daily needs. Now, health experts say that the contaminated drink water increases the risk of diseases such as cholera, typhoid, dysentery, and other diarrheal illnesses, which continue to claim lives, particularly among young children and the vulnerable communities. Now, the updated guidelines place greater emphasis on preventing contamination before it occurs rather than responding after people become sick. So WHO is encouraging governments and water authorities to strengthen water safety planning and improve routine monitoring, plus invest in systems that identify potential risks early enough. Now, the organization also recommends closer surveillance for both large and small water supply systems to ensure that communities receive clean water and safe drinking water throughout the year. Now, in addition, the guidelines include updated scientific information on harmful bacteria, viruses, and selected chemical contaminants that may represent and that may be present in the drinking water, as well as practical recommendations on how these risks can be effectively managed. Now, health officials said that water safety is not only the responsibility of the governments but also of communities and households. They also encourage the public to protect water sources from contamination and also maintain proper sanitation and, where necessary, boil or treat drinking water before consumption. So for Uganda, where outbreaks and cholera plus other waterborne diseases occasionally occur, and in some districts, experts say that access to safe drinking water remains essential in reducing preventable illnesses and improving public health. So the World Health Organization says that countries should continue investing in clean water infrastructure and regular water quality testing, plus public health awareness campaigns to ensure that every household has access to this safe drinking water. So the organization has also announced that work has already begun on the 5th edition of the guidelines, which will include additional recommendations on emerging contaminants and other public health concerns. So health experts continue to remind Ugandans that safe drinking water, proper sanitation, good hygiene remain among the most effective ways of preventing the waterborne diseases and protecting the health of families and communities. So, this brings us to the end of our health updates for today. Thank you for choosing TV1, and where we continue to help you see the difference. So as we mark the World Sickle Cell Day, we encourage everyone to know their sickle cell status, support those living with this disease, and remember that early screening and timely treatment saves lives. So stay with us, because coming up next is the health discussion, where we take a deeper look into the diseases affecting our communities. So our health experts will discuss the causes, the signs, and also the prevention, and also importance of knowing this information, and how families and our everyday life can be spared with the health information. So from me, Kaites Elizabeth, and the entire TV1, Your Health, have a pleasant evening and stay informed, stay healthy, and don't go away, because our special health discussion is coming up next after the break.